please invite Dr. Nimisha Kalia to deliver the keynote address.
Good afternoon. It's a pleasure to be here. I'm Dr. Kalia from Johns Hopkins University, and I'm going to be speaking to you today about containing healthcare costs in the corporate setting. Johns Hopkins has been working very collaborative with HCL Healthcare and to provide the best evidence-based medicine to patients and also create disease management programs. The line of my presentation is I want to present some background on the relevance of corporate health, how it applies in the US and how the same principles apply in India, and then discuss some population health management mechanisms that we've had to decrease healthcare costs in the corporate setting. Specifically, I'll be talking about the use of our on-site clinics as well as wellness programs. And then I want to talk a little bit more about the Johns Hopkins and HCL Healthcare collaboration. So I want to start off this presentation by looking at how healthy is corporate India. So when you look at this, this was a study done by Optum taking a look at about 200,000 employees' HRA data, and it shows that it's actually not very healthy. So 43% of them have a skewed body mass index. The risk of hypertension and diabetes in the population is about 30% for corporate India. Now, when I first saw this statistic, I wanted to say, okay, well, that's pretty much mirroring the US population. But when you take into context that India's workforce is on average about 29 years old and the US workforce is 40 years old, this is alarming for 29-year-olds on average for 30% of them to be at risk for hypertension and diabetes and have a skewed body mass index. So the overall picture is not very healthy. This slide really puts it into context, so overlap what we just learned about the overall corporate health of India not being very healthy. And then let's take a look at India here compared to 10 other countries. India has the very low private insurance penetration compared to out-of-pocket expenditures. So you can see that it's really an outlier when compared to other major economic forces around the world. And then when we take a deep dive into the health insurance growth by sector, although there is growth in the government and retail sectors, there is continued growth, about 16% on average, according to this McKinsey data, in the corporate sector. And claims ratio in the corporate sector tend to be the poorest of all of the sectors when you're looking at retail, government, and corporate. So I want to move now into the portion of the presentation where I talk about what I do on a day-to-day basis and how we're working with HCL to provide some of the same data and analytics here in India. So we look at population health management approaches to decrease healthcare costs in the corporate setting. This is a map of the US and it highlights where we have on-site clinics. We actually have about 63 on-site clinics. Just for the purpose of simplicity, I only included 46 of them. These 46 clinics are with PepsiCo. PepsiCo is one of our largest clients. We also work with other major Fortune 50 companies like GE, Under Armour. So 46 clinics, and the other thing I want to highlight in this picture is you can see that these clinics are located across the US. So when you're talking about places like the Midwest, you're talking about very access-poor settings. And again, we're able to maintain the quality of the healthcare providers and the quality of the healthcare and the convenience of the on-site clinics across the US with the model that we use. Our on-site clinic services really focus on the physician that's there. So the physician is the hub for all healthcare needs for the patients or the employees of that population. So they do the work, the examinations, they do the on-site formulary that's available, and they also do the basic urgent care and medical needs, along with doing healthy living programs. So this is more of the wellness program. So we're doing the biometrics, we're gathering those biometrics, doing some analysis on the biometrics to really get folks categorized into a low, medium, or high-risk category, and then providing tailored and specific on-site prevention, health promotion, and risk reduction programs. So we do many of the occupational health services as well as episodic care services for employees of large corporations. And because of the robust wellness programs that we have, the way we've kind of set up the systems to look at HRA data and have very specific and tailored programs for employee populations, here's some of the data we're looking at. Again, for sake of simplicity, I just kept it relevant to PepsiCo data, but we do have data from other clients as well. So when you look at this, this is the initial diagnosis of chronic diseases such as hypertension, hyperlipidemia, obesity, and diabetes that were diagnosed at one of our on-site clinics from the year 2009 to 2013. So keep in mind that we cover about 200,000 employees for PepsiCo. Overall in the US, we cover about 300,000 employees. Of those 200,000, many of them, about 30% of them, already had a diagnosis of hypertension, but these are new diagnoses that were made at the on-site clinic. So had these folks not seen one of our providers, they would be walking around probably asymptomatic, without any symptoms of hypertension or diabetes, but the clinic was able to capture these folks and get them enrolled into some of our wellness programs and some of our disease management programs. This is taking a look at the availability and utilization of the clinics. So like I said, we cover about 200,000 employees for PepsiCo. So how the clinic locations were selected, PepsiCo has bottling sites all around the US, and they looked at the number of injuries, and they looked at the number of employees, and decided which locations needed clinics the most. So of the sites that have clinics, about 16% in total, 95% of the employees that are located in that site avail themselves to the clinic. That's a huge penetration rate. So only about 5% of the employees are not using our clinics. So that says it's convenient risk data. The users of the clinic have a higher score as compared to non-users of the clinic. So the users of the clinic have a higher prevalence of congestive heart failure, COPD, coronary artery disease, diabetes and hypertension, and osteoarthritis. And then the next slide is going to highlight really the impact of the clinic to the healthcare plan. So this is 2013 data looking at the allowed amount per member per year for medicine and prescriptions. So the allowed amount includes the inpatient and outpatient, medical, diagnostics, and medications. So when you look at the user versus non-user, you can see that when it's not risk adjusted, the non-user cost is still 4% higher than users of the clinic. And if you remember the health risk data saying that the users are actually sicker than the non-users of the clinic and risk adjust for that, the cost goes up even higher. So it's actually 8% higher for non-users of the clinic than it is for users of the clinic. So huge cost savings to the healthcare plan when the people are using our on-site clinics appropriately and getting siphoned into the disease management programs appropriately. Most of the providers are avoiding or curbing some of the costs for secondary and tertiary health treatment facilities by using the on-site clinic. So that was actually a study, an independent study done by Mercer, looking at 3 years of data. Mercer went back and looked at 12 years of longitudinal data for us and found that the clinic users also had 117 per member per month lower healthcare spend. That was primarily driven by medical spend. So again, these employees are using the healthcare system appropriately. They're going to come to the clinic when they can. They're going to their primary care physician where instead of going to the emergency room or instead of using specialists when it's unneeded. The users also demonstrated lower utilization across all areas, so outpatient visits, specialist visits, emergency room visits, inpatients, diagnostic, and medical prescription costs were lower for users of the clinic versus non-users of the clinic. And this is significant because they also had higher engagement in their care management plan. So once we put them in a long-term diabetes care management plan or a hypertension or pre-hypertension care management plan, they have higher compliance than non-users. Overall, Mercer found that the return on investment for having a clinic to the health plan was about 3.9 if you take into account productivity gains, meaning the time potentially lost from employment for an employee. If you took that part out and said, no, let's not look at the productivity at all, without productivity, you're still looking at an ROI of 3.3 over 1. So this is direct savings to the healthcare plan. And this is actually looking at the clinics a different way. So this is looking at the clinics from the employer's point of view and saying, okay, for PepsiCo, how much money is Pepsi saving directly from having a clinic on site and managing these diseases appropriately? So Johns Hopkins developed a return on investment model with PepsiCo and an independent consultant, And the return on investment model, again, is based on direct cost. There's no projections made in this return on investment model, looking at the cost differential of what a plan would pay for a certain type of visit versus how much the visit would cost if the employee was to be seen by one of our practitioners, the time away from work, potentially, to get an appointment with a primary care physician or a specialist, and then also how long the specialist or primary care physician placed them off of work versus one of our providers. So those are the key components of the return on investment model. And overall, Pepsi's saving about $11 million a year directly from having one of our clinics on site. This is taking a look at some of the population metrics that we look at. So when we look at estimated prevalence of health risks in a population, we know that risk factors such as body weight, stress, safety belt usage, physical activity, I know these have been touched upon by our previous speakers today, but these are all very prevalent in the population, and each one of these risk factors actually increases your risk overall of health and morbidity. So the clinic is actually able to address every single one of these by making sure that we have a very well educated and very well trained provider on site to meet with the employees. And going back to kind of, looking at the analytics of categorizing folks into low risk, medium risk, and high risk individuals, this ends up costing the plan and the company a lot more. This is very intuitive, but this kind of breaks it down and puts numbers to exactly how much a low-risk individual would cost a company, and on average, how much more. You're talking about $1,200 more for a medium-risk individual versus $3,000 more a year for a high-risk individual. These folks were not non-participants in the HRA, so it would be an average of the three of these, low, medium, and high risk, presumably in this category. This is relevant to the population in India and even in the US, because as you're talking about, people moving from low risk to medium risk to high risk, and you factor in age, we know that as they age, they're going to continue to move to high risk categories, and as they, gain more and more comorbidities, they're going to move to high risk categories. So when you're talking about an older individual, the huge cost to the healthcare plan as well as to the company. It's very relevant to aging populations. So in summary, employers have specific goals. They want to select healthy individuals for employment. So how do you do this? You want, in general, if you have an employee that's working versus an employee somebody that's not working, the employee that's working is already healthier. That's called a healthy worker effect, and we know this already. So we have an opportunity to kind of optimize that health for the employee. We also want to provide programs that are aimed at preventing or delaying the onset of illnesses or impairments whenever we can, and the design medical benefit plans that incentivizes employees and their dependents to obtain medical care when conditions are potentially reversible or treatable. We, in our experience at Johns Hopkins, we've been doing this for 20 years, over 20 years, have found that having an on-site clinic, that easy access for the employee is really key, and then having robust wellness programs that are data-driven are also key to driving great outcomes. I want to talk a little bit about an exciting venture that Johns Hopkins and HCL Healthcare has been working on collaboratively. Johns Hopkins Medical Institute and HCL have delivered on-site health programs for 4 leading corporates in India. We operated in a corporate clinic that had 15,000 employee campus, and overall that year we had 25,000 unique patient encounters, and 10,000 employees participated in health risk checks. And here's what we found. The median age, again, is 29. That's correlated with the Optum data and the data from other sources as well. And this is alarming. Again, hyperlipidemia, high blood pressure, prediabetes is very prevalent in the population. Not surprising, but we're finding this data to be validated through our own experience as well. And we're working in a multi-step process to get these on-site screenings done, get lab work, and get the patients educated on exactly what their risks are. And we're using analytics, including population risk stratification, and programs designed to categorize low, medium, and high-risk individuals, and then tailoring customized programs to each one of these employees. We've had huge success with this in the US. Again, it's a win for the employee. These are employees that can have the convenience of having a clinic on site where they can see a provider anytime they need to and ask questions when they have any questions at all. Their family members can also access the clinic and get information on their health care. It's a win for the companies because the company has direct cost savings, and it's a win for the insurance plan as well because they're seeing a lot of the chronic disease management occurring on site instead of catastrophic claims going to the emergency room when they're not well controlled. So our goal is to really integrate the corporate clinics and on-site wellness programs to deliver population health management. We will get better clinical outcomes, have a better patient experience, and have lower costs to the employers as well as the insurance plans through this collaboration. So we're very excited about it. I want to thank you for your time. And I don't know if there's any time for questions, but.
Nimisha, good morning. This is Ashish here. One of the objectives of a corporate wellness program is to bring sustained behavioral change, so people are able to continue with the modifications and healthy lifestyle. Could you elaborate a little bit about the challenges you faced and how they were addressed through the on-site clinics?
Sure. I think the challenges are universal. I'm a physician first and foremost, so when I see a patient, you tell them initially that they have a diagnosis of hypertension or they're pre-hypertensive or diabetes. I think one of the first things is denial. A lot of patients, they feel fine, they're asymptomatic, so they will just not want to really engage in their own health care that much because, again, they're not feeling symptoms. So engagement and I think education for the employee has been key. We have numerous strategies that we use to really get the employees engaged. So one of the most successful, for example, for diabetes, we have a health coach that works collaboratively with the physician on site to get the employee engaged in what exactly diabetes is. And then we have things like cooking classes, and we have walking contests around campus, and we get the family members engaged as well. Using various technologically based wellness platforms, we've also been able to have peer-to-peer counseling for employees, and that seems to be very much liked because the employees as well as their dependents, so whether you're talking about a parent or a child, can engage in somebody in their own age group to get some diet and exercise counseling. So the challenge is, I think, universal to healthcare and to patient care is really getting the education across to patients, and then how do you move from educating them, letting them know what their lab values are, to really getting them engaged in their own healthcare and better healthcare consumers. So that's what we really try to focus on, is that how are we going to do this? What are we going to do with this data, and how are we going to drive outcomes? So I hope that answers your question.
Hi, my name is Vikas and I represent an organization called MediMojo. We are also into employee wellness activities. My question to would be that how much of digital engagement and gamification can impact adherence and acceptance among the set of employees that we are, your experiences on that?
So I'll try to repeat the question because, so you're saying?
The impact of digital engagement and gamification of all this that we talk about, like the activities that you do, the lifestyle modification that you do, how much of gamification can impact these activities and adherence to these activities?
Well, 29% of the disease burden is caused by diseases that are caused and will improve once you change your risk factors. So I think having the physician engaged, having the clinicians engaged, so our team consists of not just the physician, but we have kind of ancillary staff as well. So we have the health and wellness coach that works very closely with the employee. We have dietitians, So getting that multidisciplinary approach absolutely makes a big difference to the employees. As you can see, we're diagnosing people. So again, people don't have to come into the clinic for any reason, but they do choose to. They have a good experience at the clinic. They build trust with the provider on site, and then they choose to come back. And they actually choose to get their family members involved as well in their own healthcare. So I think it makes a huge impact. They are better healthcare consumers overall. They're using their resources appropriately, and they're using our resources appropriately. So I think it makes a huge impact. So it depends. So thank you for that. So it depends. So I think the digital resources that we've used, they have been, the ones that we've had the most success with are the ones that are the personalized digital apps or wearables. So they have to be somehow tailored to the employee. So for example, that peer-to-peer diabetes education program has been one of the most successful that I can recall, because again, it looks at the demographics of the patient and says, what are the barriers to this being successful? One of the barriers is speaking to somebody that, first of all, we know that if they're on a computer screen, there's less likely to be a bond already. So they try to make it as personal of an experience as possible by having games on there, by having videos that you can see on at your own pace, on your own time, and then also having that peer-to-peer counseling available, and then getting the diet plans on there. Everything is on a wellness portal that they can access. So I think it makes a big difference. Any other questions? No? Okay. Well, thank you so much for your time.
Thank you, Dr. Kalia, for your insightful keynote address.